Okay.
Yes, sir, audible.
Yeah. So, my dear students, our topic for today is PCOD, which stands for polycystic ovarian disease. At times, it is also referred to as a PCOS, that is polycystic ovarian syndrome. Now, this is also called as Steen-Leventhal syndrome. This is also called as a Steen-Leventhal syndrome. Now, what actually happens in this disease? Okay, let us discuss a case and let us understand this. So, my dear students, let us say, suppose, for example, a young female any young female who complains of number one, delayed menses, delayed menses or irregular menses. Associated with weight gain, plus hair loss, which is referred to as alopecia. So this female will complain of a lot of hair fall as well. In some of the females, this is associated with acne, that is development of pimples on face. And very classically, what usually gets this female to clinic is either the complaint of irregular periods, or in future, the chief complaint is infertility. Yeah, so this is difficulty in getting pregnant. So, my dear students, we are talking about a case wherein any young female who complains of either irregular periods associated with weight gain or with hair loss with pimples, and in future complaining of infertility. So this group of symptomatology fits into PCOD disease, that is polycystic ovarian disease. Now what exactly happens in this disease? So let us catch the basics first. Now basic number one, when we consider the human female reproductive system, so let us see the basic diagram of human female reproductive system. So here ideally we are supposed to know 4 important parts. The lowermost part, which is called as vagina, then the womb, which is called as uterus, the tube, which is called as oviduct, also referred to as fallopian tube. Yeah, so also referred to as fallopian tube. And then this main sex organ, oval shaped ovary. Now the rule says one ovary produces one ovum in 1 month. Then in the next month, the alternate ovary, produces ovum. So ovum is also called as egg cell, which is the female reproductive cell. So let's say this month, this ovary produces ovum here. Then in the next month, what we will find is if in this month, this ovary produces ovum, then in the next month, this ovary will produce ovum and release it into the fallopian tube. So this happens alternately. However, next, basic number 2. If we take one ovary out, let us say this is ovary, and if we cut it and we study the internal cells of ovary, so in a cut section, which is also called as histology of ovary. So let us zoom this ovary and let us study in detail. So in the cut section of ovary, what we will find is here there are tiny cells. One of the cell will grow further and this will develop further, and slowly and steadily this keeps on growing. So let us say suppose these cells are called as oogonia. So one of the cell will develop further so as to form group of cells which is called as primary follicle. This will grow further so as to form another group of cell. So here we have one cell at the center followed by many tiny cells surrounding it. Same, one cell at the center followed by many tiny cells surrounding it. So now students, what happens inside the ovary is one of the cells of oogonia will develop into primary follicle. Primary follicle will develop into secondary follicle. Follicle refers to this entire group of cells. Now, secondary follicle will develop further into tertiary follicle. And then tertiary follicle further develops into the most matured follicle, which is called as Graafian follicle. Now, students, at the center of this Graafian follicle, let us say this. Here is the main cell, which is ovum. So then a point comes where the Graafian follicle will break and it will release the ovum out. So this is the ovum which is released out. And then this Graafian follicle gets converted into another group of cells, which is called as corpus luteum. And corpus luteum further gets converted into another group of cells, which is called as corpus albicans. Now, students, we have to remember that initially there was these tiny cells which were called as oogonia. One of the cells of oogonia developed into primary follicle, Primary follicle developed into secondary follicle, then into tertiary follicle, then into Graafian follicle. And then the Graafian follicle breaks so as to release the ovum and gets converted into corpus luteum and finally into corpus albicans. See, that is how ovum is released in female in 1 month. Here, coming back to the diagram. So when I say that this ovary has released ovum here, so inside this ovary, how this ovum is released, we have seen in this diagram, that is in the histology. So once if you study the cut section of ovary, you realize that, okay, so these group of cells will grow primary, secondary, tertiary, Graafian follicle. Graafian follicle contains ovum at the center and that is how the ovum is released. Finally, the degenerated Graafian follicle gets converted into corpus luteum and finally into corpus albicans. Now students, you will have to memorize that the inner layer of this Graafian follicle, inner layer of Graafian follicle is called as theca interna. Why we will have to memorize this? Because it produces the main female sex hormone, which is called as estrogen. Whereas this corpus luteum produces another female sex hormone, which is called as progesterone. Now, students, do not forget this. Graafian follicle produces first female sex hormone, that is estrogen, and corpus luteum produces another female sex hormone that is progesterone. All right, everybody reply to me. Is this much clear? Yes or no?
Yes, sir.
All right, okay. Now, the next part of this is another level of concept where now we will talk only and only about hormones. So let's go into the basics of hormones. All right, now students, see what ideally happens is here exactly at the center of our forehead, there is a tiny gland which is called as pituitary gland. This pituitary gland produces one hormone which is called as gonadotropin hormone. Now, gonadotropin hormone will act on gonads. The meaning of the word gonad is reproductive organ. So this gonadotropin hormone, it is of two types. FSH and LH. FSH stands for follicle stimulating hormone. Follicle stimulating hormone. And LH stands for luteinizing hormone. Now everybody understand this very nicely, that FSH is follicle stimulating hormone. So this FSH is responsible when it is released from pituitary gland. This FSH is responsible for converting the primary follicle into secondary follicle, then converting the secondary follicle into tertiary follicle, finally into Graafian follicle. So see, that's how the naming is kept. FSH, follicle stimulating hormone. So it stimulates the primary follicle and it says, come on, grow into secondary follicle. Then it stimulates the secondary follicle so that it can grow into tertiary follicle. So that is the main function of FSH. So everybody just go with the name, go with the title. FSH is called as FSH, that is follicle stimulating hormone, because the job of this hormone is only and only to stimulate the follicles. All right, next. Then the another hormone on list is LH. LH, this hormone. LH will come here on corpus luteum. it will act on corpus luteum and it will cause a release of this hormone which is called as progesterone. Remember, so LH is responsible for releasing progesterone. Now, let us repeat this. So FSH, follicle stimulating hormone. If we have to understand the function of FSH, then what FSH will do is, let us say this is tiny cell oogonia. FSH will convert it into primary follicle. Then it will stimulate this primary follicle so as to get converted into secondary follicle. Then it will stimulate this secondary follicle so as to grow into tertiary follicle. It will stimulate the tertiary follicle so as to get converted into the most mature follicle, which is called as Graafian follicle. So that is the function of FSH. Then Graafian follicle will release this hormone which is called as estrogen. Then because of LH, moment LH is released, okay, Graafian follicle will break and it will release out ovum. So very importantly, we have to remember that LH is responsible for ovulation. That is the release of ovum. Then Graafian follicle will get converted into corpus luteum. So LH will act on corpus luteum so as to cause a release of progesterone. All right, everybody confirm, is this much clear? Yes or no?
Yes, sir.
Yes, sir. Clear.
Okay. Now see, so what you need to understand and you need to remember is that FSH will simply make all of these follicles grow. That's why the name. This follicle stimulating hormone, and the most mature follicle is Graafian follicle, and Graafian follicle will release estrogen. Then LH. LH will cause breaking of Graafian follicle so as to release ovum. That act is called as ovulation. And then the leftover corpus luteum, LH will act on corpus luteum so as to cause release of progesterone. Now, in general, what we have to remember is, remember in basics, another important trick, P. P for progesterone, P for pregnancy. So progesterone is also called as pregnancy hormone because it will bring about the necessary changes in the body which is required during pregnancy. That is why progesterone is also called as pregnancy hormone. If we go into the very fine detailing of this, then we will realize that in progesterone, the word gest is derived from the word gestation, and gestation refers to pregnancy. Now, here when we are talking about that progesterone refers to pregnancy, so we should understand that during pregnancy, a female will menstruate or she will not menstruate. Everybody answer this.
She will not.
So
She will not. Correct. That means during pregnancy, let's go into the technical term. She will experience amenorrhea. Now, beta, amenorrhea stands for absence of periods, that is absence of menses. Now, this is our kickstart for today. We need to understand what actually happens in PCOD because of which female will not have periods for 2 months or 3 months and so on. So now let us understand the mechanism of PCOD. Okay. Quick recalling basics. So we are talking about PCOD where a female will have delayed periods or irregular periods. She will experience weight gain, hair fall, pimples on face, and in future she can have infertility. We went into the basic, we found that ultimately female reproductive system consists of ovary, vagina, oviduct, fallopian tube, and uterus. One ovary produces one ovum in 1 month. In the next month, alternate ovary will produce ovum. Another basic, we found the most mature follicle is Graafian follicle. Graafian follicle releases estrogen and corpus luteum produces progesterone. FSH is responsible for stimulating the follicle so that Graafian follicle is formed, which will release estrogen. And LH is responsible for breaking the Graafian follicle so that ovum is released out. This act is called as ovulation. And then the corpus luteum will release a progesterone. Both of this FSH and LH is released from pituitary gland. Now, coming back to another basic of hormone, progesterone. P for progesterone, P for pregnancy. Progesterone is called as pregnancy hormone. And during pregnancy, there is a state of amenorrhea, that is absence of menses. Now, ideally what happens in a female with PCOD? So let's say if any female comes with a complaint of irregular periods, along with that she's complaining of weight gain or probably hair fall, pimples. Then in that case, how will the treating doctor diagnose a PCOD? So for diagnosing PCOD, doctor will run down certain blood tests. Now, in blood test, we need to study the hormone levels. So your doctor will ask for a blood test where we will find out how much is the FSH level and how much is the LH level in a female. Okay. And we will find that in this particular female, FSH will be low and LH will be comparatively higher. Everybody just memorize this. In a PCOD female, FSH will be lower and LH will be higher. Okay. Another important parameter is what the treating doctor will do is he will also check the ratio of LH and FSH. Now, in a PCOD female, LH will be always more than normal and FSH will be less than normal. So this LH to FSH ratio will be always more. Normally, this ratio should be less than 2:1. But here this will be more than 2:1. Or it can be 3:1. So that indicates LH will be comparatively much higher and FSH will be comparatively much lower. Now, what do we derive from this ratio? Now, we need to understand in a PCOD female, if FSH is less, that means understand in her ovary, these follicles are not stimulated so as to grow further because we need this hormone for stimulating the follicle. So normally FSH will cause the primary follicle to grow into secondary into tertiary into Graafian follicle, and then the ovum will come out. And once the ovum will come out, if it is not fertilized, then that unfertilized ovum will come out in the form of bleeding, which is called as menstrual bleeding. But my dear students, understand that in this PCOD, FSH itself is low. So these follicles are not stimulated. So this female will have ovary with all tiny immature follicles. All right, everybody answer me why immature follicles? Because which hormone is low?
Sir, FSH.
Perfect. So FSH is low. That is why she will have all immature follicles. Now, another point you need to remember that this female will have high LH. And LH is responsible for release of progesterone. This progesterone, if we do a progesterone level also, progesterone level will be comparatively higher in this female. So definitely this female will have a sort of pregnancy-like state, that is amenorrhea. Though she is not pregnant, but because of this hormone being higher, LH and progesterone, what will happen is ultimately she will not menstruate. Now, along with this, one gold standard report one gold standard report is USG, that is ultrasonography, which is also called as ultrasound. In this ultrasonography or ultrasound, the treating radiologist will find that inside the ovary there are many immature follicles. See, this is how this will look like. Normally, ovary looks like this in sonography, like this. Primary, secondary follicle, tertiary follicle, Graafian follicle. This is how normally it should look like. That the follicles are maturing. But here, ovary will show all immature follicles. Now, this immature follicles looks as if these are like tiny beads, tiny pearls present on ovary. That is why this is also described as necklace ovary, as if ovary is wearing a necklace of these are tiny immature follicles. So the treating doctor will write that there are many immature follicles, and all of these are follicles. They are not growing, they are not developing. Now, if the follicle will grow to Graafian follicle, then only the ovum will be released, and then only the female will menstruate. But if the follicles are immature, then the basically ovum will not be released. So in that case, how will the doctor treat? The treatment for PCOD largely depends upon number one, controlling the weight of the patient. Number two, controlling the hair fall. In PCOD, one unusual point is some of the females will develop complaint of hirsutism also. When we say hirsutism, that means she will develop mustache and beard. So treatment aims at controlling the weight, controlling the hair fall, treating the hirsutism, and regularizing the periods. So regularizing her menses. Now, in regard to weight, okay, we have to give her a diet plan for weight loss, and this has to be associated with exercise. See, anything which is ghee, butter, oil, cheese, okay, excess of potatoes, excess of rice should be avoided by the patient. Supplemented with exercise so that the patient can cut down weight. In regard to hair fall, there is this vitamin which is called as biotin. Biotin is a very good vitamin for promoting hair growth. And along with that, a very high protein diet. Now, for regularizing the menses and for controlling the hirsutism, normally allopathic doctors will prescribe hormonal tablets to the patient. And these hormonal tablets are being prescribed for 3 months together. But here I must tell you that in the long run, if in case, if any of your client who's on allopathy, that is modern medicine, since long duration, and if he is unrelieved, then I must tell you that we have seen some wonderful cures in Ayurveda as well as with homeopathic line of treatment. So the plan of treatment is number one, okay, a diet plan associated with exercise, associated with biotin vitamin tablets and protein diet. And with respect to tablets and medicines, okay, allopathy, that is modern medicine. If allopathy or modern medicine helps, if it is helpful, well and good. That's fantastic. And it will be mostly helpful for infertility. But if in case allopathy is not relieving the patient, then the final line of treatment should be Ayurveda or homeopathic medicine, which the expert doctor in your neighborhood can guide the patient better. All right. Everybody reply to me. Is this clear? Yes or no?
Yes, sir. Clear.
All right. Now, if anybody has any doubt with respect to this, please ask me.
Sir, may I?
Yeah, please go ahead.
Sir, can gluten products can be given to the PCOD patients? Like,
Sorry.
sir, gluten products, like those food products which contain gluten.
Correct. Right. As such, see what happens is, if in case gluten products can be prescribed, but if in case the patient doesn't have sensitivity to gluten, because very rarely some of the patients, okay, they might have intolerance towards gluten. So what we can do is we can advise a short test dose of it, and we can observe the patient. If in case the patient assimilates and finds it compliant with the diet, then you can continue. It doesn't give rise to any complication.
Okay, sir.
All right. Any other doubt? Please go ahead.
Sir, somebody has written in the chat box.
Okay, wait, let me check. All right, see, biotin supplements. Okay, we have a doubt with respect to biotin supplements. Ideally, what we do is for hair fall. Okay, basically for hair fall, what I do in my clinical practice is, okay, there is a tablet called as hair ad, which contains good amount of biotin, and we prescribe this tablet, one in morning, one at night, for over 3 months. Sorry, this is number one. Number two, in allopathy, there is this oil which is called as minoxidil. It is available in 2% and 5%. Usually doctors start with 2%, and if given a choice, if there is no relief, then we go ahead with 5%. So this oil has to be applied 3 times a week. And this can be mixed up with a homeopathic oil, which is called as jaborandi oil, which you will get only in homeopathic pharmacy. So we can advise the patient to apply 3 times a week minoxidil and remaining 3 days jaborandi. Or if given a choice, if minoxidil doesn't relieve, then basically for all 7 days a week, jaborandi works fantastically. Okay. And if you don't get this hair ad tablet, you go to any generic medical and you ask for a biotin supplement or a biotin tablet. They will give you different brand name. Okay. You can take any of this because it doesn't matter much. Another question we have is, how much sugar-free tablets we recommend to sugar patient if she has sweet tooth? All right. Okay. Sugar patient means, that means we are talking about a diabetes. If we have a patient of diabetes, then as such, in general, the patient can go ahead with sugar-free tablets. But if given a choice, as much as possible, anything which is sweet, anything which contains high carbs, like potato, rice, and in fruits, mango and banana, should be avoided. If the patient had sweet teeth, okay, so as much as possible, do not advise sugar-free. So for diabetes patient, usually they should avoid all this. All right. Any other doubt?
Yes, sir. Sir,
Yeah.
the prescription you gave for hair fall and like the medicine for biotin, is it like applicable only if the reason behind the hair fall is PCOS, or in general it is prescribed?
All right, this is a good doubt. But in general, for any case of hair fall, we can go ahead with this because this is the line of treatment for hair fall. Okay.
Yes, and minoxidil, like I used it, but I had a severe hair fall in the starting days when I was using it,
Right,
and then
right,
it
right.
got better.
Correct. Okay. And even if the cure stops, you can go ahead with Jaborandi hair oil. That is superb.
Okay, sir. Thank you.
Yep. All right. So, students, let us end this session over here. We will provide you the recording of this. Go through it once again. Read.
Okay, so we are done with the medical part. Okay, now I'll explain you how to give a diet plan to a PCOS patient. Okay, when we talk about the diet, okay, as we discussed in the last lecture, that it is all about the lifestyle. Because of the poor lifestyle, you could face such problems of PCOS. Okay, so when we talk about the diet should be given. Okay, it should be consisting of, you know, only and only Indian diet plan. Okay, it should not be any of the fancy diets. This diet plan should be having all the home remedies to regulate the menses of a person. Okay, and into this, do not go for any vegan diet or FAD diets or something. Instead, choose foods that are very natural and which is close to the nature, organic. Okay, go for more of seasonal and local foods which is easily available. Okay, do not go for any of the vegan diet, FAD diets or something just to lose weight. Your prime focus into this should be more onto the nutrition of a person.
Ma'am, then it is a myth that they say ki in the initially they should be given vegan diet and gluten free diet for PCOS patient.
Definitely it is, because I feel that go for the natural foods compared to the vegan or FD diets or something, because it is more about improving your lifestyle rather than just to focus on the weight loss. Okay, so your prime focus should be nutrition.
So, ma'am,
Another
dairy
you
products
could
should not
observe
be. Dairy
another
products
you
should
could be
be.
observe in the improvement in the insulin resistance. Okay, your also the focus should be weight maintenance. Along with that, you need to relieve your patient from all the PCOS symptoms. Gurleet, I am left with the session. Will come to your dairy part also, because that will be covered into the whatever I am diet plan I am teaching. So okay, maybe by the end of the session, your all doubts will be cleared. Okay. So when we talk about the diet of a patient, our prime focus first of all is the lifestyle. Lifestyle के साथ what is the main important thing is to regulate the menses of a girl. Okay, so regulate the menses, we follow a golden rule which is known as seed cycling. Take a screenshot of this. I would request you to take a screenshot. Is it done?
Yes, ma'am.
Okay, seed cycling is generally to be done for balancing the hormones. Okay, balancing the hormones in a woman. Okay, I don't know if you have heard about it, but seed cycling is one of the easiest way you can support your hormones in a gentle way. Okay, so I was talking about seed cycling. It is generally to be followed to balance the hormones. Also, it helps in regulating the menses of a woman. Okay, so now what happens is, just for an example, understand. Like, if a client comes to you on the date of 25th or 26th, she has enrolled. Okay, she complains that she has absence of the menses, and she is not the menses are not regular, and she has symptoms of the facial hair and everything. So you understand that the patient is going through PCOS. Okay, so you will give a diet plan. So the diet plan might start from 1st of February, just example. So from 1st Feb till 15th of Feb, you will suggest her to take 1 teaspoon of pumpkin seeds. Along with that, you will suggest her to take 1 teaspoon of flax seeds. Okay, this was for the 15 days. Now, when we talk about the next 15 days, that is from 16th of Feb till 1st March. For the next 15 days, you will tell her to consume 1 teaspoon of sesame seeds. Along with that, 1 teaspoon of sunflower seeds. Now, this can be consumed in any form. Either you are taking it, as in munching option, you are, taking it, mixing that in a smoothie or something. It can be anything, but it should be consumed within 15 days cycle. From 1st to 14 day of your cycle. Okay, you need to consume flax seeds and pumpkin seed. From 15 to 28 day of your cycle, okay, you need to consume 1 teaspoon of sesame seeds and 1 teaspoon of sunflower seeds. That is how you will able to regulate your menses and able to, this is one of the remedy I am showing you. Along with that, you need to make sure that you are following a proper diet to regulate the menses and improve the lifestyle. Got it? Anyone has any doubt into this? This is a
Ma'am,
phase. First
basically, I
one,
just want to
just a second,
ask
just a
that.
second, just a second, bacha. This is a phase from 1st to 14 day of your cycle. Okay, this is a phase of menstruation to ovulation phase. Okay, and this is from ovulation, that you are ovulating, till menstruation phase. Yeah, you have any doubt?
यस मैम, आई वाज आस्किंग कि ये मतलब जैसे हमने एक ओव्यूलेशन तक दिया, मतलब देयर मस्ट बी समथिंग टू डू विद द हार्मोन्स, राइट? तो मतलब
Yeah,
आई जस्ट वांट टू नो कि पंपकिन और फ्लेक्स सीड्स में ऐसा क्या है जो हम मतलब जो ओव्यूलेशन तक देते हैं और फिर हम चेंज करते हैं सेसमे टू सनफ्लावर? तो इज देयर एनी स्पेसिफिक दैट यू कैन टेल मी?
because it has essential fatty acids into it. Okay, because what happens during the first phase of your cycle, it helps in improving your estrogen levels into your body. Okay, so that is why we are including this seeds into the body, so that it helps in regulating the menses.
ओके
Got
मैम,
it?
मतलब स्पेसिफिकली पंपकिन और फ्लेक्स सीड्स जो हैं वो एस्ट्रोजन लेवल्स को इम्प्रूव करते हैं, और
See,
सेसमे
we
और
have two
सनफ्लावर
phase.
से
I'll explain this also. Just a second. Okay, ये menstruation से ovulation का जो phase होता है ना, this is known as, okay, इसको हम बोल सकते हैं follicular phase in a medical term. Okay, and this ovulation से menstruation वाला phase जो होता है ना, in medical term, it is known as luteal phase. तब ये phase में होता क्या है? This is, we are giving pumpkin seeds and flax seeds to improve the estrogen levels into your body. Okay, while compared to this, we are giving sunflower seeds and sesame seeds into the luteal phase to improve the progesterone, or you can say to boost up the progesterone hormones into your body. Got it? Sesame seeds, again, it is rich source of zinc, which helps in boosting your progesterone production, and also it contains to it also helps in blocking excess of estrogen level. Okay, and now sunflower seeds is also, you could see that it is high in vitamin E and some minerals like selenium. So vitamin E is also helping in boosting the progesterone, and it is good for regulating your menses, and it balances your hormones in a very positive way, and it's a very natural way of regulating your hormonal cycle. Got it? Okay, I'll move forward to the another
yes,
home
yes ma'am.
remedies. Please take a screenshot of this. Okay, this is one of the remedy which you can give to your clients, but along with that there are other remedies also which you can suggest, because obviously the client will be taking the diet plan for a month, 2 months, or 3 months. Okay, so if this is for a month, along with that you will give other remedies also to figure out, to regulate the menses and overall balancing the hormones into the body. Okay, so home remedies will be, first is cinnamon powder. You can give 1 teaspoon of cinnamon powder in the morning along with the water, normal water. Okay, this can be given as first thing in the morning, that is on rising. Okay, another is you can give flax seeds, which we discussed in the sit cycling also. You can give flaxseed tea also in the evening time. You could also give apple cider vinegar. Again, in the on rising. Fourth, you could give fenugreek tea, or fenugreek seeds is also fine. If you are soaking that overnight in water, and if you are having this water in the morning, even that is beneficial. Okay, you can give teas like green tea, spearmint tea, which is online available. Along with that, you can give fennel seed water, or you can tell them to chew that after your meals, even that is fine. Include smoothies like green juice, beetroot juice. And if you're giving some soups or something, even that is fine. Okay, so basically this was the home remedy. But when we talk about your diet, just take a screenshot of this. We'll talk a little more detail about the diet in the next slide.
मैम ग्रीन जूस में what should be given in
Green leafy
green?
vegetables. Green leafy vegetables. Anything of your choice, anything the client is comfortable having it, anything you can give.
Okay, ma'am.
Take a screenshot of this. Let me know once it is done. Okay, so now when we talk about the term diet of a PCOS, so home remedies to ho gaya, but at the same time, you need to give the diet which is having full of complex carbs. It should be having high fiber foods. It should have all the healthy fats. Along with that, the diet should be rich in protein, and again, hydration, one of the most important role into the diet. Okay, so these are the foods you need to include. Along with that, make sure you are avoiding foods like refined sugar, all the processed foods. Okay, all the soya products needs to be avoided. And somebody says, you need to avoid milk, all the dairy products or something. That is all myth. You can give it in a very limited amount, but that needs to be given. ऐसा कुछ नहीं होता है कि मतलब मिल्क आपने दे दिया तो उसके वजह से PCOS और भी बढ़ेगा. That's all a myth. Okay, so I'll give you a diet plan as an example so that you understand what can be given and what not. Take a screenshot. Is it done? Just hold on a second. Okay, so when we plan a diet for a PCOS patient, in the morning time, when the person gets up in the morning, empty stomach, you can give methi water, okay, as it reduces the blood sugar level into your body. Either you can give curry leaves water. You need to soak curry leaves overnight and give it to them. Okay, otherwise cinnamon or anything is also fine. Okay, tell them to exercise more often or meditate. Exercise can be anything, either walking,
Ma'am, curry leaves water, it is, I think it is also helpful for hair loss control, ma'am.
yeah, obviously the client comes to you for the weight loss only when it comes to PCOS. So both
Mm.
are the things for the weight loss, and we need to give some remedies which is useful for the weight loss and as well as for the PCOS. Okay, so you can give walking, meditation, yoga, or if they like to do gymming, even that is fine. Along with that, your breakfast, obviously it involves, and it is basically based on the 24-hour recall of a person. Okay, so into this you can give some moong, full of protein, just say moong dal chila or something, or you can say some poha or upma is also fine. Include dal into that in a form of protein. Mid morning you can give something like smoothie juice, as I suggested to you in the previous slide. It can be, as I discussed in the weight loss part, the smoothie should be having the combination of your fruits and vegetables. Okay, so it can be apple spinach or anything of your choice. Lunch you can give sprouts, salad.
Ma'am, can you tell more smoothies in mid morning, ma'am? More smoothies options.
More smoothies you can give any other vegetable juice, just a celery is, even that is fine. You can give, add oranges also. Depends what client is comfortable. This is just an example I am.
ABC juice or apple beetroot
Yeah,
carrot
even
juice.
that, yeah, even that is fine. Okay,
Okay.
you can give sprout salad. Along with that, any sabzi with roti and buttermilk, again their choice, that should be low in fat. Okay, evening snack you can give
Ma'am, can we give the whole wheat roti and multigrain roti also can we give, ma'am?
नहीं, मल्टीग्रेन रोटी कैन नॉट बी कंज्यूम, बिकॉज क्या होता है ना, मल्टीग्रेन एक ग्रेन, ये रूल मैंने आपको पहले से ही वेट लॉस में बताया, कोई भी एक ग्रेन एट अ टाइम दो, सब एक साथ नहीं. रोटी,
Ma'am,
सीरियल्स,
can you tell in English, ma'am? Because
yeah,
Hindi.
so sorry. One grain at a time should be given. As I discussed in the weight loss part also, no roti and rice together. It can be either roti, it can be rice. If you want to gain weight, then you can consume both the thing together, but do not take both the greens at the same time. So it can be either jawar roti, either bajra roti, complete whole sorry, grain
Okay.
should be taken at one time.
Okay. Okay.
Okay, so now when I talk about evening snack, it can be any fruit of your choice. You can top with seeds. This can be seed cycling. You got a chance to add on. Okay, mid evening you can give some tea, either green tea or flaxseed tea. Okay, dinner you can give rice with dal or either khichdi. Got it? Post lunch, you can tell them to walk for 30 minutes. Even that is fine. Take a screenshot of this. And after following the menstrual seed cycling, okay, if the patient gets periods or something, obviously there will be pain. So you can suggest them to have, heating pads. You can suggest, either you can suggest fennel seed water, even that can be soothing for the stomach. You can suggest all such things.